Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, the producer of Public Health on Call. Today, Stephanie Desmond talks to Nicole Brambilla, a reporter in Lancaster, Pennsylvania, about how COVID-19 has impacted the Amish and Mennonite communities there. They discuss a large outbreak that happened early in the pandemic and the challenges associated with convincing the community to be vaccinated. Let's listen. Nicole Brambilla, thanks so much for joining me.
Thanks for having me.
So, Nicole, you cover the Amish and Mennonite communities in Lancaster, Pennsylvania for the local newspaper. And you've recently written a really interesting story about their relationship with COVID-19. So first, I guess, please describe the community for us, for those of us who aren't completely familiar.
It's one of the largest, if not the largest in the United States. They can be identified fairly easily driving their horse and buggies. And in fact, they attract a lot of visitors every year to come and take tours and take buggy rides. So it's a community that is, I'm struggling for the word here. They're not isolated, but they are separate from the larger Lancaster County community. And they're a huge source of revenue in terms of the businesses that they own, whether it's furniture making or fruits and vegetable stands, or even the tours. Milk, dairy industry is very large here. So they're a huge component of our community.
Mm-hmm. So tell me briefly also about sort of the relationship that they may have with maybe public health, organized medicine. I know that they eschew modern technology. Do they visit doctors? Are they part of local medical community in any way?
The thing that's really interesting about the Plain community in terms of technology, they eschew the technology that would disrupt the family unit. So they do have, modern conveniences in their homes like washing machines and lights. It's gas powered instead of electricity generated, which is really interesting. But it's all around keeping that inner family intact. The relationship that they have with modern medicine is really kind of complex. There are healthcare providers that cater to the Amish community, and the hospitals here, systems, we have 3 different hospital systems, have inroads to those communities. But by and large, and this isn't everybody, obviously, but by and large, they tend to favor more alternative medicine, acupuncture, herbs, those kinds of things, rather than going to the doctor's office like you and I would.
So there's a belief that they were hit very hard by COVID last year. And there is a conversation about whether they reached sort of a herd immunity as a result. That's not necessarily embraced by everybody. Talk to me about that debate.
Yeah, any discussion about how the Plain community was impacted by COVID-19 has to come with this caveat, which is we just don't have the data. And we don't have the data because largely they sidestepped getting tested. And my understanding in talking with a healthcare provider, the largest in the area, to the Plain community, is that there was a lot of concern about, hospitals and visitation. And if you get sent to the hospital, then you're going to die by yourself. Because at the time, if you recall, hospitals had shut down visitation and had taken other measures to mitigate the spread. So we just don't have the testing data, and we just don't know for sure that was the case. But again, this particular provider believes, based on his observations and the number of Plain Amish and Old Mennonite that were coming into their offices for services, that 90% of families had cases. And in his own his own family, he did as well. He got sick with COVID in November. One of his children got it twice. But like most of us that have this kind of experience, I know in my household as well, that one might get COVID and then somebody else doesn't get COVID. And so that's why he made the distinction about families and not 90% of everybody. The challenge, of course, a year after the fact is going and piecing it together. Because even if you did antibody testing, which some of the experts that I spoke to talked about, it could show up or it may not. And a year after the fact, testing for antibodies and there's no presence for it doesn't mean that there wasn't an infection. So that makes it challenging. I think the thing that he really wanted to impart the most was that to explain why when we are out and about, we see so few Amish and Old Order Mennonite abiding by the masking and social distancing and other mitigation efforts.
And what he's saying is that they're not using those measures because they feel like they're immune.
Correct.
But even if they were immune a year ago, they're likely not immune today.
Well, and that was one of the things that these epidemiologists that I talked to, including David Dowdy from Johns Hopkins, is that we just don't know. It's still a novel virus, and we don't know how long the immunity lasts. And then we have this additional concern with these emerging variants and how that will play into it. There are efforts underway to begin to educate and hopefully vaccinate the Plain community when the time comes. And in fact, I was just speaking with somebody last week about this. So breaking news here on your podcast, that when the Johnson & Johnson vaccine becomes more available, the idea is that we would only have to rally the Plain community once with the Johnson & Johnson vaccine. So that's the strategy that they're hoping to take. There are very good examples with polio and others where there have been outbreaks in the past where modern medicine has been able to rally the Plain community to get vaccinated. And so people are crossing their fingers hoping that this will happen with COVID-19 as well.
I mean, I guess that's the bigger concern, right? That they will not be vaccinated. And it's a large group that could really not only spread it among themselves, but among others in the community.
True. And if you look at the Amish and Old Order Mennonite community in Lancaster County, it's about 8% of our population. And then you throw in those that have vaccine hesitancy from communities of color that perhaps rightly so have a distrust of the government and of modern medicine. And then those that are, don't want to vaccinate their children. There's a real concern that we won't hit that 80, 90% mark that Dr. Fauci and others say that we should to get herd immunity. So it's a very real concern in our community.
Mm-hmm. And I understand it's a rural community. And so therefore there is also probably increased hesitancy there, like we're seeing in other parts of the country.
Yeah, one of the experts that I spoke to is from Elizabethton College. And he talked about really that it's indistinguishable. We think of the Plain community being, so different because it's insular. But really they share a lot of the same attitudes of those in rural America. And so the challenges there are not all that much different. It's just compounded because of some of their religious beliefs and persecution in the past that informs them today.
Mm-hmm. I understand that they're still very actively participating in church, that there's large gatherings going on, and that I assume that's something that very much concerns public health officials.
It does. I mean, the Plain community early on shut down. They stopped church services and school, and they did the other mitigation efforts that, everybody else in Lancaster County was doing early on in the pandemic. The difference is that when they resumed prior to everything reopening in Pennsylvania, they did so with gusto. And so, yes, they were doing those church services and other gatherings that are a concern. It remains to be seen, how this will all shake out and whether or not we'll get this buy-in from the Amish community. Will really take an exerted effort for the trusted partners that we have and the bishops to get the word out and perhaps rally them as we have with polio and measles, I think was the other outbreak in the Plain community that we were able to successfully vaccinate in the past.
Mm-hmm. Do these communities generally get their children vaccinated, or do they get exemptions from vaccine for school?
There's a really interesting report that we published on our website that you can see. It was a doctoral thesis, I believe it was in 2017, that found that the Plain community, in our community in Lancaster, this wasn't elsewhere, had about almost 59%, 60% acceptance rate of vaccines. And so there's really an opportunity for medical providers to explore this and discuss it rather than just dismissing out of hand, oh, they're Amish, oh, they're old order Mennonite, they're not going to get vaccinated. And so I think there are some real opportunities there that can hopefully factor into our vaccination efforts here.
I think it's very interesting. Obviously, there's a lot of concern everywhere about vaccine hesitancy, but I think from what I've been learning is that there are a lot of, you really can't make wide assumptions, right? It's dangerous to make wide assumptions that people, like this group isn't going to get vaccinated and this one will. I think what you just said shows that, there is wiggle room, right? There are ways that we can communicate with folks who come from different backgrounds and get them to get these vaccines.
There's a lot of wiggle room. And, like with the polio effort, for example, when parents and grandparents remember the days of polio and the impact that it can have on children and others, then they tend to want their offspring and their children to get vaccinated. So, a lot of it also is life experiences. So I like the wiggle room that you said. I think that's a really apropos description of what can be done here.
Yeah. And I imagine, though, that the biggest concern from public health officials, though, is that, they're so close and they have multi-generational families and there's elderly people, and that is probably what's driving a lot of the worry.
Because they're insular but not isolated, they still run the same risks that everybody else does in Lancaster County in terms of exposure to COVID-19, which, as you know, is only getting more contagious and more deadly. So, it sounds cheesy, but it's so true that I get the vaccine not just for me, but for everyone in my community. And, my hope, along with the medical providers here that are spearheading this effort in Lancaster County, is that that'll be a message that will resonate in the Plain community.
Nicole Brambilla, thank you so much for your time.
Thank you so much for having me. I appreciate you.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.